Well, good morning again, everyone. My name is Kasey. I work for the EMS for Children Innovation and Improvement Center, and I would like to welcome you to this month's Pediatric Readiness Quality Improvement Community of Practice session. And we are excited to welcome you all, whether you're a returning participant from the PRQC or joining us for the first time as an NPRQI user. We look forward to catching up with you all and helping to create a network of ED professionals from across the country who are passionate about improving pediatric emergency care. And we hope that this is a space to come together and share your experiences, network with your peers, and provide one another with support as you navigate your quality improvement efforts. As today is our last community of practice session, we appreciate you all being here as we take today to celebrate what we have accomplished and what we have planned for our next steps. Now, before we get started with today's session, we would like to acknowledge that the EMSC Innovation and Improvement Center is funded through a cooperative agreement with the Health Resources and Services Administration, which is within the U.S. Department of Health and Human Services. As a cooperative agreement with a federal agency, the EIC must adhere to executive orders and related federal guidance. The contents of today's presentation are those of the authors and do not necessarily represent the official views nor an endorsement by HRSA, HHS, or the U.S. government. So on this slide, we are looking at the progression of the Pediatric Readiness Quality Improvement Collaborative over time. We did begin in 2018 with the first PRQC cohort. I wonder if we might have anyone on the call who was a part of the 2018 cohort. If you are, I wouldn't mind. If you wouldn't mind, please just raising your hand or giving us a thumbs up in the chat if you might have been a part of that original cohort. Right. Don't see any coming up. Well, that cohort included 140 participants from 140 participating hospitals and 400 participants, which represented 17 states. This was one of our initial efforts to bring hospitals together to improve pediatric readiness. By 2023, our second cohort demonstrated significant growth, and we expanded to 212 hospitals and engaged 629 participants from 41 states and territories. You can see our growing interest and commitment to pediatric readiness over the last 7 years. I wonder if we might have some 2023 participants on the call. If you did participate in that 2023 cohort, if you could raise your hand or give us a thumbs up in the chat. A couple familiar names, so thumbs up. Thank you. Yes. Thank you all for continuing to participate over the last year in the community of practice. That was, over the last year, or current year, 2025, we did transition to our community of practice model, which is smaller in size, but still 52 hospitals and 61 participants from 18 states have continued to meet and focus on sustaining improvement and sharing best practices. So thank you all for being here today again. Now, you are all joining from across the nation, and this map illustrates the states that are participating in our community of practice. You might notice some darker shades representing states with higher levels of participation, while lighter shades indicating fewer participants. You might be wondering, what is next on our PRQC journey? So looking ahead, we will be launching the EMSC NPRQI Collaborative, formerly known as the PRQC. We are building on the foundation of success that began in 2018, and this is a rebranding effort for the collaborative to better align with the national efforts and reduce confusion. So we hope that you all will continue to participate in this effort and engage in pediatric readiness activities. We did want to use today's session to help provide an overview of what we aim to accomplish during this next phase with the 2026 EMSC NPRQI Collaborative, which aims to engage emergency departments in this completely free initiative that is designed to support you in deepening your quality improvement work, strengthen pediatric readiness, and collaborate with other EDs from across the nation. Whether you're already using the NPRQI platform or just getting started, this is your opportunity to improve care for children in your ED. Do notice some familiar names and folks who may have already indicated that they look forward to participating in this collaborative, but we just want to provide some more information and guidance during today's session for everybody. We want to start back with how the EMSC NPRQI Collaborative works. So the EMSC NPRQI Collaborative supports EDs in transitioning from simply identifying gaps to making measurable improvement in pediatric readiness. It is based on the IHI Breakthrough Series model, and the collaborative guides EDs from identifying gaps to implementing improvement through a structured QI method, expert coaching, and peer learning. So here's a bit more about how it works. Your ED's team will work together to pick one of our 4 clinical focus areas to work on improving. This ensures that your efforts are targeted and impactful. We then provide multiple touchpoints for engagement, opportunities to learn from subject matter experts, as well as your peers during collaborative sessions, fireside chats, and opportunities for one-on-one support during office hours. You'll use a plan, do, study, act, or a PDSA cycle to test ideas, refine them, and make improvements that stick. While teams spend time implementing and assessing local improvement efforts within their ED, collaborative sessions serve as a forum for all participants to gather virtually and share their successes and challenges. By joining the EMSC NPRQI Collaborative, you will have access to support and coaching to help guide you through the process. We believe collaboration is key, and you'll learn from your peers facing similar challenges. Have exposure to a variety of approaches which help you adapt proven strategies to your own environment. Participation in the collaborative can support your professional development while achieving other tangible outcomes, including improved patient and staff satisfaction, plus access to resources. This is your chance to make real differences for kids receiving care in your ED. So let's talk a little bit about NPRQI. The National Pediatric Readiness Quality Initiative is a free, self-paced quality improvement platform designed for emergency departments. What it does is helps EDs measure, benchmark, and improve their performance on key pediatric processes in a secure way. One of the biggest benefits is that it gives hospitals a clear framework for continuous quality improvement. That's essential for improving pediatric readiness and making sure kids get the best possible care. Now, if I might get a pulse check on the audience here, how many of you are currently utilizing the NPRQI platform or might be in the process of registering for it? Again, if you want to give me a thumbs up or raise your hand, either in the React or in the chat. All right. Great to see that some of you are in the process of registering. Some of you already have been maybe using the platform for some time. Well, here's a bit about why this tool is so important for the collaborative. It's what allows EDs to track their progress while implementing quality improvement projects. Without NPRQI, it's hard to know if the changes you're making are actually moving that needle. So ultimately, NPRQI is designed to inform and empower frontline staff so that they have the insights and tools to make real improvements. So the EMSC NPRQI Collaborative is designed to give every ED the flexibility to focus on what matters most for their patients while providing support and resources. You'll choose one of the 4 clinical areas of focus, either pain assessment, abnormal vital sign reassessment, suicide assessment and management, or head trauma, which utilize one or more of the NPRQI quality measures, which were developed with input from 25+ professional organizations and experts to improve pediatric outcomes. And you won't be doing it alone. We provide free coaching and the NPRQI platform support, access to real-time NPRQI dashboards, and national benchmarking. And professional development credits. You'll also have access to collaborative sessions and fireside chats with pediatric readiness and quality improvement experts, plus the peer connections with EDs like yours. The collaborative will start next January and is structured in 4 phases. We guide teams from orientation to lasting improvement. Each phase is building on the last, ensuring that progress is both achievable and sustainable. We start by getting everyone set up. Sounds like a lot of you might be in this initial stage already of gaining access to the NPRQI platform. Starting in January, you will then enter some baseline data and attend fireside chats on your selected area of focus. This is also when you will review our intervention bundles and your baseline data. Next, you will complete the 2026 National Pediatric Readiness Project Assessment, where you'll receive your pediatric readiness score. attend collaborative sessions, and begin planning your quality improvement project. During phase 3, teams will begin implementing PDSA cycles. With ongoing coaching and support, additional data entry will continue throughout this phase, so you can monitor your performance and identify those changes that result in improvement. Finally, we focus on sustaining your gains and planning for long-term success and reviewing opportunities to stay connected and continue learning. So wanted to walk through with you all today the steps for joining the collaborative. Seems like many of you might be in different points. Maybe you have already registered, maybe you've only registered for NPRQI and not sure if you've signed up for the collaborative yet. But before we walk through those, operational steps, we want to help you spread the word within your ED. Start by engaging your leadership and staff. You can share our promotional flyer and get your team excited about this opportunity to improve pediatric readiness. I'm going to go ahead and switch views here and share with you where you might find some of these resources. You should be seeing now our the Emergency Medical Services for Children webpage. If you navigate to engage with EMSC and learn about collaboratives, click on the Pediatric Readiness for EDs. That'll bring you to the EMSC NPRQI Collaborative homepage. You can then navigate to our resources. Scroll down to implementation resources. You'll find a few things that'll help you engage your ED. First, we have our sort of a guideline or some path to participation resource. This provides an overview of what the collaborative offers to participants and to the ED, and a great starting point for some talking points whenever you're going to your leadership, with some bulleted examples of what the talking points might be. You can include these whenever you're having a conversation or maybe in an email to your leadership. And one we already looked at. Here we have some more talking points broken down into why this work matters, what the collaborative offers, and what the benefits to your ED are. A little bit about what the commitment might look like from you or from members of your staff, and then a final key message to leadership. We also have an informational flyer. It's a great resource to really engage your staff, let them know what this opportunity involves. And it's also another opportunity to share that sign-up information. If maybe you're sharing it with a colleague from another institution. After, you got that buy-in and you're ready to sign up, we also provide some resources for those next steps. We have implementation steps for success. This walks us through, steps 1 through 5. It's a great starting point for understanding what we are going to work through during the collaborative. We also have a building your team, some considerations for who you might want to invite to be on your team. We look for a multidisciplinary approach to help you do this work. Some resources there, and then not so much you might find this useful as you're, putting together your communications for why you would like to participate, but I feel like this resource is going to be more handy down the line during the collaborative. But again, those are under Engage with EMSC, learn about the collaborative, under Pediatric Readiness, and you'll navigate to our resources and check out these implementation resources to help you get started. A great place to do that. And then this is also where you'll find our intervention bundles that'll support you during that collaborative phase as we are launching next year. So while I have my other view up, I wanted to also share with you, if you've not already, where you sign up for the collaborative. Again, a key part of participating in the EMSC NPRQI Collaborative is the utilization of the National Pediatric Readiness Quality Initiative Data Platform. This is where you'll be able to monitor your progress using your patient encounter data. If you have not already registered for NPRQI, I'll put this link in the chat, but you'll navigate here and you'll begin the process of signing up for the platform. And while you're doing so, to enroll in the collaborative, all you need to do is answer yes to this question, whether or not you're interested in participating in the EMSC NPRQI Collaborative. So if you have not yet signed up for the collaborative, or signed up for NPRQI and the collaborative, I'll have you navigate to this survey and begin the process there. You'll share with us some information about your emergency department, and also list with us who your users are going to be. And a key part of the process of getting access to the platform is submitting a participant organization agreement. All those details are there in that survey, and it'll walk you through the process. Now, if you are an existing user of NPRQI and you have not yet indicated to us that you would like to join the 2026 EMSC NPRQI Collaborative, I have a separate, shorter survey for you. It is just the same question. You'll share with us, your contact information, what hospital you're joining from, and whether or not you're interested in participating. And then I will begin reaching out to you with next steps and sharing some information. So we have tried to streamline that registration process for those who might have been a part of it, part of our 2024 cohort. So hopeful that is all very helpful to you all. What questions do you all have in sort of that registration process, or maybe the resources we have available to support you? Feel free to come off mute and share your questions. Has everyone on the call already registered for the 2026 EMSC NPRQI Collaborative? Yeah, looking forward to seeing you, Heather, back, Amanda. Not yet, Tessa. If you have any questions about that process, or if you would like to go over some resources, or if you have any questions about participating, I'd be happy to answer those. Right, Deborah's just getting signed in today. And for those who maybe are just thinking about joining the collaborative, we do have some past participants on. So if you would like to ask any questions of our past participants, I'm sure they would be happy to help answer or share a bit about their experiences. And I don't know if there's maybe anyone on the call who, earlier mentioned you were in the process of gaining access to NPRQI. If you've run into any hurdles of getting support from your leadership, we also have some resources to help with that. So if that would be helpful, just let me know and I can share those as well. Well, that's all we had for you all today. We just wanted to celebrate a bit about where we were. Thank you, Heather, for your question. Heather is asking about our some training for our new environment. So for those who had previously been using NPRQI, you might have been notified that we are updating the platform. We anticipate it to go live in January of next year in coordination with the launch of the collaborative. So Heather will be incorporating a lot of that orientation to the new platform along with our collaborative sessions to help folks get used to the new environment. But we have had some really great feedback from our initial beta testers indicating that they're really enjoying the platform. So we are excited to share it with you all. All right, so we just wanted to share a bit about where we've been and where we're going, and thank you all for continuing to join us for these sessions and participate in this work. We look forward to continuing to have opportunities to support you in your quality improvement efforts, in addition to hearing from you all on the great work that you do and you all supporting one another through these efforts. So with that, I'll just stay on for a few minutes for some questions. Happy to also set up any one-on-one calls if you all would find that helpful as you navigate these next steps.